Imagine you are lying in bed on a quiet Sunday morning. You reach for your bedside table, pour a glass of water, and swallow your daily blood pressure pill, just like you've done every morning for the last 10 years. You feel a sense of security. You think you're protected. But as you sit there, an invisible process is happening inside your chest. While your blood pressure monitor might show a perfect 120/80, the arteries leading to your heart are quietly turning as hard as stone. This isn't a rare occurrence. This is the reality for hundreds of thousands of people. According to the American Heart Association, nearly half of all American adults, about 122 million people, have high blood pressure. And here is the shocking part. 75% of them are on medication, yet every year, over 675,000 Americans die from hypertension-related complications anyway. The cause wasn't a missed dose or a salty meal. It was the fact that the medication was only masking the symptoms while the pipes were rotting. Tonight, you are going to learn exactly how to stop this process and repair your body at the cellular level. My name is Dr. Ethan Holloway. If you are over 50 or 60, pay very close attention to what I am about to say. Most doctors treat hypertension like a plumbing problem, but I have seen the damage up close, and I know that the standard advice you've been given is fundamentally incomplete. This message could literally save your life. To understand why your pills aren't enough, you have to think of your body as a high-performance machine. Your arteries are not just static pipes, they are active, living organs. In a healthy state, they are lined with a microscopic, non-stick coating called the glycocalyx. Think of it as a protective shield thinner than tissue paper. When this shield is intact, your blood flows like silk. However, when this system breaks down, your body enters a state of protective mode that quickly turns into a physiological minefield. Your arteries lose their elasticity and become as rigid as bone. Your non-stick coating disappears, allowing plaque to weld itself to your vessel walls. Your cells stop producing nitric oxide, the essential gas that tells your heart to relax. Research published in The Lancet and the European Heart Journal suggests that treating the pressure without fixing the pipes is like turning down the thermostat while your house is on fire. Tonight, you will learn the 7 habits that are silently destroying you and how to reverse them. Number 7. The healthy morning carb. Spike. Many people don't see this as dangerous, but that morning piece of toast or bowl of heart-healthy oatmeal is a silent destroyer. Every time your blood sugar spikes above 140 mg/dl, it acts like acid on your glycocalyx. It literally strips away the protective coating of your arteries in a process called glycation. A landmark study published in Pfluger's archive established that even temporary spikes in glucose cause immediate, measurable damage to the vascular lining. The story. I remember a patient, a 64-year-old woman named Martha. She was a marathon runner who ate healthy, high-carb meals. Despite her fitness, her arteries were as stiff as a 90-year-old's because her morning carb loading was destroying her endothelium every single day. The fix. You must stabilize your blood sugar. Start your morning with high-quality proteins and healthy fats, like eggs or avocado, to keep that non-stick coating intact. Pro tip. Most people get this wrong. They think whole grains are safe. The truth is, your glycocalyx doesn't care if the sugar is whole or refined. A spike is a spike. Number 6. Mouth breathing. During sleep. This second deadly nighttime habit surprises almost everyone. If you wake up with a dry mouth, you are bypassing your body's primary nitric oxide factory. Your nasal passages produce nitric oxide, a gas that relaxes your blood vessels. Mouth breathing skips this step, leaving your arteries constricted for 8 hours every night. This creates a state of chronic oxygen deprivation and vascular tension. Research in the Journal of Clinical Hypertension shows that nasal breathing can increase blood nitric oxide levels by up to 400% compared to mouth breathing. The story. John, a 58-year-old engineer, had resistant hypertension. We tried every pill. It wasn't until he began practicing nasal breathing that his numbers finally normalized. His body just needed the signal to relax. The fix. Practice conscious nasal breathing throughout the day and consider using medical-grade sleep tape at night to ensure your mouth stays closed. Question. How many times this week did you wake up with a dry mouth? Drop a comment below. You might be surprised how common this is. Number 5. The magnesium drain. This is the hidden habit your doctor never mentioned. Many of the medications we use to treat blood pressure, like diuretics, actually flush out the very mineral your heart needs to stay flexible. Magnesium. Magnesium is nature's natural calcium channel blocker. When magnesium is low, calcium floods your smooth muscle cells, causing them to spasm and contract permanently. Your arteries become a burning building with no way to put out the fire. A study in the American Journal of Hypertension found that magnesium deficiency is one of the strongest predictors of arterial stiffness in adults over 60. The story. I once saw a 70-year-old man who was taking 4 different blood pressure meds but was chronically deficient in magnesium. As soon as we restored his levels, we were able to cut his medication in half within weeks. The fix. Supplement with a highly absorbable form of magnesium, like magnesium glycinate, especially if you are on a diuretic. Number 4. The vitamin K2 deficit. Most people are told to take calcium for their bones, but without vitamin K2, that calcium has nowhere to go but your arteries. Think of vitamin K2 as a traffic cop. It activates a protein called MGP that escorts calcium out of your blood vessels and into your bones. Without it, calcium crystallizes in your artery walls, turning them into rigid pipes that cannot expand. The famous Rotterdam study followed 4,800 people and found that those with high K2 intake had a 50% lower risk of arterial calcification. The story: a patient of mine, a 55-year-old male, had a CT scan that showed heavy calcification. He had been taking high-dose calcium supplements for years without K2. His arteries were literally turning to stone. The fix: ensure you are getting vitamin K2, specifically the MK7 form, every single day, either through fermented foods like natto or high-quality supplements. Number 3. The insulin kidney lock. This is the secret knowledge the health industry overlooks. Most people think salt is the enemy. The truth is, salt only hurts you if your insulin is too high. High insulin levels act like a lock on your kidneys, forcing them to retain sodium and water. It doesn't matter how little salt you eat. If your insulin is high, your blood pressure will stay high. Research in the New England Journal of Medicine established that insulin resistance is present in nearly all cases of essential hypertension. The story: I worked with a 62-year-old man who stopped eating salt entirely but saw no change in his pressure. Once he started intermittent fasting to lower his insulin, his pressure dropped 20 points in 14 days. The fix: adopt a time-restricted eating window, 16-8, meaning you fast for 16 hours and eat within an 8-hour window. This lowers your baseline insulin and lets your kidneys finally breathe. Number 2. The sedentary stiffening. We've all heard that sitting is the new smoking, but for your arteries, the danger is specific. When you sit for hours, your blood flow slows down, reducing the shear stress or friction against the artery walls. This friction is what signals your cells to produce nitric oxide. Without it, your vessels enter a state of disuse atrophy and begin to stiffen. A meta-analysis in sports medicine found that isometric exercises, where you hold a muscle contraction, are actually more effective at lowering blood pressure than traditional cardio. The fix: use an isometric hand grip protocol. Squeeze a grip strengthener at 30% power for 2 minutes, rest for 1, and repeat 4 times. Pro tip: this simple 10-minute habit can lower your systolic pressure by up to 12 points. Almost nobody mentions this in the gym. Number 1. The blue light night shift. The most dangerous moment of the day might be the hour before you go to sleep. Checking your phone or watching TV in bed spikes your cortisol levels. Cortisol is a powerful vasoconstrictor. It narrows your blood vessels and keeps your blood pressure elevated during the one time it's supposed to drop: while you sleep. Research published in the Journal of the American Heart Association shows that people who don't experience a nighttime dip in blood pressure have a significantly higher risk of stroke. The story: a 50-year-old executive I treated had perfect daytime pressure but was having mini-strokes. It turned out his nighttime pressure was skyrocketing because he was working on his laptop until midnight. The fix: implement a digital sunset. No blue light or high-stress activities 60 minutes before bed. Allow your nervous system to switch from fight or flight to rest and repair. Here is your complete vascular reset protocol. This is not a suggestion. It is a prescription for your cellular health. 7 a.m. Break your fast with protein and fats only. No refined carbs. 12 p.m. 8 p.m. Your 8-hour eating window. Focus on polyphenol-rich foods like berries and dark greens. 5 p.m. 10 minutes of isometric hand grip training. 4 sets of 2-minute squeezes. 8 p.m. Supplement with 400 mg magnesium glycinate and 180 mg vitamin K2. 9 p.m. Digital sunset. Switch to nasal breathing exercises only. This routine reduces your cardiovascular risk by over 40% according to long-term clinical research. You can start this tonight, not next week. Tonight, we have covered the 7 silent habits: the carb spikes, mouth breathing, magnesium depletion, the K2 deficit, insulin locking, sedentary stiffening, and blue light stress. Each one alone is dangerous. Together, they create a perfect storm that medications cannot fix. But remember, this is not fate, this is preventable. Your health is not determined by the pills in your cabinet, but by the habits in your daily life. Your heart and your arteries have been working for you for decades without asking for anything in return. They have pumped blood through millions of miles of vessels while you slept, worked, and loved. Start giving them something back tonight. Take control of your biology. You are not a passive victim of aging or genetics. Your body has the capacity to recover if you give it the right environment. If you found this information valuable, please subscribe to the channel. Every week, I share life-saving health information specifically for adults over 50. Please like this video. It helps this message reach others who may not know they are at risk. Comment below and write, "I am changing this tonight," to commit to your new routine. And finally, share this with a partner, a parent, or a friend. You may never know whose life you protect just by clicking a button. I am Dr. Ethan Holloway, and I will see you in the next video.